Hello, this is Sudharshan, and in this episode PH 1.19 part 4, we will talk about anti-Parkinsonian drugs. So coming to the classification, we have the drugs that act on dopaminergic system and the drugs that act on cholinergic system. So with dopaminergic system, the precursor, no doubt L-dopa or levodopa. And then agonists of dopamine, it will bind to that D1 and D2 receptors. We have bromocriptine, then ropinirole and pramipexole, and MAO-B or monoamino oxidase B inhibitors. Please note there is MAO-A also, but we will see about MAO-B, that is selegiline and rasagiline. Then COMT, that is catechol O-methyltransferase inhibitors like tolcapone and entacapone. And in the cholinergic system, again with the anticholinergic drugs that treat Parkinson's like benzhexol, benztropine, trade name Cogentin, then bipyridine, procyclidine, and the first generation antihistaminics like promethazine, diphenhydramine, orphanadrine, dimenhydrinate, ceclizine, meclizine, etc. And mainly we'll focus on the dopaminergic system. So we have L-dopa. So with respect to L-dopa, what happens when it enters the brain? So this L-dopa is getting decarboxylated by the enzyme dopa decarboxylase, and vitamin B6 is the cofactor. Then it converts to dopamine and it will bind to the D2 receptors there. And metabolically, dopamine will divide through two enzymes, that is MAO-B or monoamine oxidase B into DOPAC, that is nothing but 3,4-dihydroxyphenyl acetic acid, and using COMT, catechol O-methyltransferase, it will become 3-MT or 3-methoxytyramine. And then always levodopa is given in combination with carbidopa. And a very important side effect of this L-dopa is on-off phenomenon. So that is nothing but on means there is relief from the symptoms for some time, and off means again the symptoms will appear. So that is called on-off phenomenon. And then apart from that, it causes GI distress, then serious disturbances like tachycardia, tardive dyskinesia, and then neuropsychiatric symptoms. This is common for all the anti-Parkinsonian drugs, the side effects. But the combination L-dopa and carbidopa, there is increased bioavailability. And they cross the blood-brain barrier also. And next we have the dopamine receptor agonists, that is bromocriptine, ropinirole and pramipexole. So bromocriptine is very specific for D2 and to an extent even D1 also. Same with ropinirole. So both bromocriptine and ropinirole will act on D2. But difference is bromocriptine to an extent will act on D1. And pramipexole, it is purely at D3 receptor. And with the use, there is one extra use, it can treat restless leg syndrome. And this bromocriptine here, it is an ergot alkaloid. Yes, and very important point, only L-dopa will cause on-off phenomenon. No other class of the drugs will cause on-off phenomenon. And that is rare in other classes of this, the other group of these anti-Parkinsonian drugs. Then we have the COMT inhibitors, that is tolcapone and entacapone. So the mechanism of action, so mainly it is going to inhibit catechol O-methyltransferase that will convert dopamine into 3-methoxytyramine. And very importantly, tolcapone crosses blood-brain barrier, so it is not preferred. Instead, L-dopa and carbidopa, the trade name is Sinemet, it is combined with entacapone. And tolcapone causes hepatotoxicity. Yes, and then we have MAO-B inhibitors. that is seligilin and rasagilin. Mechanism of action, this monoamine oxidase B, it will convert dopamine into dopac. It will basically inhibit that conversion, dopamine to dopac, that is 3,4-dihydroxyphenyl acetic acid. And then with respect to this thing, so L-dopa and carbidopa is more commonly given with rasagilin, because seligilin converts into toxic metabolites like amphetamine and dextroamphetamine, which will cause hyperexcitation of the CNS. And then finally we have NMDA receptor antagonist, that is amantadine, which is also an antiviral drug, and it can also be given with the L-dopa and carbidopa route. Yes, and with the drug interactions, especially with L-dopa, it is there, that is MAO inhibitors with vitamin B6, because that is the cofactor, then with antihypertensive drugs, and then with anti-emetic drugs like metoclopramide. So that is all about anti-Parkinsonian drugs. So thank you so much. We'll see in the next lesson.